Next, we have Dr. Leroy Rebello from India to speak on advanced strategies and specialized techniques, exosomes and PRP in wound healing. Dr. Leroy, you have until 10:45. Thank you.
Yeah. Can I get the mic? This. Good morning, and I would like to thank all of you, and a special thanks to Dr. Paramjit for inviting me here to speak on this topic of exosomes. I know this is a hot topic, and before this, I would like to say that exosomes can't be taught in one sitting, and exosomes, you need to actually understand the theory behind it, and for every condition, how to use it and what to use and when not to use exosomes. So for that, before I start, we are having a small workshop. How can I change the slide? Yeah, right? Yeah, we're having a small workshop, and if you want to join the workshop, you can scan the code or write the number, and you will be added to the workshop. The workshop is on the 23rd, 24th. Okay. Anyway, so I'll start it. So what are exosomes? Exosomes basically are small particles that come out of cells. These are not cells themselves. These are cell signaling factors. Now, what is a cell signaling factors? Something that tells a cell what to do. Okay, like if you want to turn on the air conditioning in this room, what would you do? You would take a switch and turn it on, right? Or you would have a remote control. With the remote control, you press and you'll turn it on. Now what happens when you press the remote control? There is a small signal that tells the air condition or the appliance to turn on. Same way, our cells, when they are sick, they stop functioning well, and because they stop functioning well, they need something to tell them what to do. Like cancer cells forget how to die, right? They die with necrosis. They forgot how to die with apoptosis. So we tell them how to die. A second thing, I'm just going through it fast because few minutes will not be enough, but I'll try and cover what I can, is the number of exosomes people talk about, right? I have 10 billion, just like how you have stem cells. So when you calculate stem cells, it is per kg body weight, right? You calculate a few million into the kg body weight, and that's the amount of stem cells you need. But when you go for exosomes, it's not like that. I give you a simple example. If you have a TV that is manufactured by Samsung company, you need a Samsung remote to turn it on, right? If I give you a Sony remote, will it turn on? No, right? If I give you 2 Sony remotes, will it turn on? If I give you 100 Sony remotes, will it turn on? No. So you just need the right signal. So one signal is more than enough. So again, when you talk about exosomes, it's having the right exosomes in the right place and in the right condition that there is. Okay, so anyway, this is a picture from the flight that I came from Mumbai, and this is my lab where we work. So this is what generally we do. So you see, this is a simple diagram or a simple picture showing the endocytosis, the endosome, the lysosomes, and these exosomes. So for these exosomes to come out that are useful, what do you need? You need the right endocytosis. The cell should eat the right substance to secrete the right exosome, right? So this whole condition of the cell eating and then secreting this exosomes is called preconditioning. So preconditioning is much more important when you do autologous exosome therapy, okay, as compared to any other or just injecting some kind of exosomes somewhere. So there are three things. One are the exosomes, the microvessels, and the apoptotic bodies. We are interested only in the exosomes. So only in the exosomes, what do? We filter them, correct? If you have all these things in your solution, how would you separate? By a simple method of filtration. So we at Biotex has developed a method where you filter only these particular type of exosomes that come out. Now, a lot of people do exosomes and then they say, oh, my results are not good, I don't get results. Why? Because there is no preconditioning. If the preconditioning is not there in itself, these exosomes will not be of good quality. So first we created exosomes by growing the stem cells and preparing it from the media. Okay, but again for that you need a lab, you need a lot of expertise and all that, and anything that comes with a lot of expertise has a lot of chances where you can go wrong, has a lot of chances where things can, you know, falter. So I always believe that the most difficult problems are solved in the most simplest way. Now, what's the difference between PRP and exosomes? PRP is technically platelet-rich plasma. Now, you've all been using platelet-rich plasma since a long time, because if you see most of the kits, the autologous kits or the PRP kits look the same. You take out blood, you centrifuge, you do something. Now, how do you know? There are two ways to tell. The first way is that you take that and put it under the microscope. In the microscope, you'll see platelets if it's PRP. If it's exosome, you won't see any platelets. How many of you are doing live blood analysis or have heard of live blood analysis? So if you're doing live blood analysis, you'll definitely be able to differentiate between the two. Okay. In exosome, when you put it under the microscope, you'll see a very smooth substance or a very smooth matrix. Exosome can only be seen in an electron microscope. You can't see it in a normal light microscope or a dark field microscope. Okay, now what is the difference between stem cell therapy and exosome therapy? So stem cell therapy is basically stem cells. There are basically different types of stem cells, like mesenchymal stem cells, MSCs, iPSCs, that is induced pluripotent stem cells, and exosomes are basically particles. So the main difference between an exosome and a stem cell or a cell therapy is that exosome is not a cell. Okay, it is secreted from a cell. So exosomes can cross the blood-brain barrier. Again, as I said, it's more of a targeted therapy. So I have a patient who has a stroke or a patient who has ischemia in a particular area in the brain. What will I do? I will precondition the body to produce exosomes that go to that particular organ and that particular area and act over there. And how do I deliver it? I can deliver it, one, transcranially with neurosurgery center, or intravenously, because they already crossed the blood-brain barrier, so why would I go for a transcranial procedure? Secondly, we have found out now some of the exosomes are photoactive. What do I mean by photoactive? When I inject them in the body and I turn on a certain light, as in a laser light, I would use 532 wavelength, because why? 532 is absorbed by hemoglobin, and exosomes will be present in the blood. This will cause the exosomes to activate at that particular site. Again, there is a pulse that you keep on pulsing with that particular laser light. So you see, exosomes have different markers, CD63, CD90, CD9, CD81, all these markers. And these different markers have different pathways, and these pathways help your body heal, or they help your body inflame. So there are two types of exosomes now, inflammatory exosomes and anti-inflammatory exosome. We want exosome that are anti-inflammatory, right? We don't want exosome that is inflammatory. Now, why does this happen? Normally, where does your body produce exosome? Exosome your body produces when it is under stress, correct? When your body is under stress, your body starts to produce exosome, your body starts to heal itself. Now, there are two types of stress, good stress and bad stress. We all know that, right? So how would I make your body under stress? One is heat shock protein, where you sit in the FIR or far infrared. Two, cold shock protein, cold plunges, correct? That's a natural way. But remember, when you do all these things, your pituitary kicks into action. And when your pituitary kicks into action, there is body's auto-thermoregulation which comes into play. And because of this thermoregulation, you know, it takes time. That is why we have a therapy called hypothermia chambers and hypothermia therapy. What do you do in a hypothermia therapy in the cancer? You heat the body, right? And then you put some drug like B17, or you can put IPT, insulin potentiation therapy, all that. So if you combine those therapies along with your exosome therapy, you get a very good result. The same thing is in the wound healing. Why is the wound not healing? Because the cell have forgotten that they have to grow, there is something called tissue contact factor. Cell is not producing tissue contact factor. Because the cell is not producing tissue contact factor, the wound is not healing. How will you make the brain heal? How will you have the person who is having senile problem start healing or start generating new neurons? You know, our brain is neuroplastic, means it keeps changing. There is something called BDNF, brain derived neurotrophic factor. So how do you produce brain derived neurotrophic factor? There are certain supplements that you eat that can produce brain derived neurotrophic factor, Second, you can produce brain-derived neurotrophic factor in the lab. Thirdly, there is something called GC-MAF, granulocyte coronary macrophage, MAF, activating factor, that also produces GC-MAF. So when you are on GC-MAF, you do the right preconditioning, and then you go for an exosome. You will get a very good exosomes that can, target certain therapy. Okay, so it can be used in hair, it can be used in skin. I show you some pictures. Okay, so what does it do? It causes skin regeneration. It has an angiogenic ability. So I'm using it now in patients with ARMD, age-related macular degeneration, especially the dry type. Okay. Along with that, I'm also trying to use it in cases of dry eye. So what I do is that I take the exosome, I convert it into eye drops, and I put eye drops. I give the patient 1 bottle of eye drops to put in the eye, and then it gets better. So this eye drop treatment was actually told to me by Dr. Sunita, who's behind, and many patients have got much better after using this. Secondly, patients with autoimmune disease, you can inject autoimmune disease of the eye, around the eye. I have remember the conversation where she said, inject it around the eye, and after that, optic nerves have started to get better. People's visual acuity has got better. Osteoarthritis, most common condition. So exosome can be used in osteoarthritis. Both you have to give it locally as well as you have to give it systemically. So this is the mechanism of action on how it works. You can see all these receptors get activated, MHC1, MHC2, okay, RAB molecule integrin, and that's how it helps the upregulation of inflammatory and upregulation of anti-inflammatory cytokines, downregulation of apoptosis. Cancer, we spoke about cancer. So exosomes change the microenvironment in which the cancer is. Now cancer can be changed. It is all about the epigenetics. So exosomes is one of the factors. It's not the only factor, but it is one of the factors. Again, I say no factor is the only factor. Today we have exosome, it's like wow. Tomorrow you have something, it's like wow. These are all one of the factors that change the epigenetics. So if we change the epigenetics properly, what happens? Definitely cancer cells change. And as these cancer cells change, our body gets better. So along with my cancer therapy, where I'm doing a hyperthermia, I'm doing a lot of, I generally do IPT, insulin potentiation vitamin C therapy for most of our cancer cells. And especially solid tumors, tumors that are difficult to reach even with radiation. Today they have gamma knife, so we work with cancer center that sends us patients basically after gamma knife therapy. So after gamma knife, my IVCT and exosome in combination work very well. Now you see these exosomes also come with some microRNAs. Now these microRNAs come into your genome. That is why it is always safer and better to use your own exosome or autologous exosome. Why would you want someone else's RNA inside you, right? When you get exosome in a bottle, many times we don't know the source, we don't know how it is produced. If you know, it's good. Sometimes they can filter out microRNAs. but how many are filtering it out? It's important for you as a doctor to ask your supplier, does this have microRNA? If yes, show me the report. And how is it filtered out? What is the process? And after that, the report of checking that there are no microRNAs or foreign RNAs that will start some other protein production in your body. But from your own body, there's no problem, because your own microRNA going back into you, it's fine. It's not going to harm you. Okay, so again, tumor-derived exosomes. Now we are working on exosomes in diagnosis. So we are seeing that, I don't know how many of you have heard of circulating CTC, circulating tumor cells or circulating cancer cells. So that's the entire cell that is circulating. Now, even before the cells become cancer, they secrete signals. Signals work both ways, right? Signals, like for example, you're communicating with a mobile, you can talk both ways, nothing that goes, that's a signal. If we would have told 5 generations ago, somebody sitting here in Malaysia has a plastic piece in his hand and speaking, and somewhere on the other side of the world in America is listening, people would have laughed at us. How can you speak in plastic and someone listens on the other side of the world from another plastic piece? So those are signals which transfer. So same way we are working on exosomes that now tell us that these cells are going to fall sick. So we are coming out with exosome readers and exosome assays that tell us, okay, you take a drop of blood and you put it in your assay and you'll see that you'll have a particular exosome positive. That means you know the risk is much higher because he's producing those kind of exosomes in the body. Secondly, the future of exosome is going to be more personal. What do I mean personal? Therapeutic exosome is going to be more personal. You will be given a certain drug. That drug will produce its own exosome in your body. And then that will be extracted and used for you in your own therapy. So your body is going to become the next lab which is going to synthesize your own medicine. Okay, so exosomes in cancer development, metastasis and drug resistance, because there is a formula that we've worked out on antibiotic resistance. You know, everyone has this big problem in all multi-speciality hospitals, so did I, of antibiotic resistance. We don't know which antibiotic is going to be sensitive to which bacteria, right? Unless you do a culture and sensitivity test. Even after that test, many times when you give it in the ICU or when you give it on the bedside, it doesn't work. So now we are studying the bacteria in the cell culture, and the bacteria is telling us they are going to die with this 1, 2, 3, 4, 5, 6, or they are going to survive with this. Then accordingly we will give the antibiotic. So this is going to be a revolution in medicine and a revolution in antibiotic testing or antibiotic sensitivity. So very simple, just to sum it up, you can draw the blood, you prepare the exosome and give it to the target organ. You can give it by IV or you can give it by local injection. Okay, I'll just skip most of the slides because each of the slide has a 1-hour discussion. So role of exosomes, and we spoke about this central nervous system. We spoke, so in a lot of patients with peripheral neuropathy, our first 2 lectures spoke about, Dr. Paramjeev spoke about wounds. Most of the wounds come on the foot that I have seen, especially diabetic wounds. And most of the wounds start with diabetic peripheral neuropathy. So if you can treat diabetic peripheral neuropathy along with this, you will get a good result. Secondly, regeneration of nervous system can be done along with the exosomes. There is something, if you see if a nerve is cut, the nerves sends out axons to search for the other end. If you remember, there was something called Nessels degeneration and Nessels regeneration of nerves. So this helps the Nessel system for the regeneration and stopping the degeneration. MSC-derived stem cells on autoimmune diseases. MSC-derived stem cells and exosomes. So from your MSCs, you can produce exosomes also and inject it. That is 3 times more potent than only injecting your MSCs. Secondly, MSCs from amniotic fluid, as we speak, are being collected by gynecologists and obstetricians. Exosomes are being prepared, and these exosomes are being back injected into the scars of the delivery, so the scar is getting much better. Secondly, this is being frozen and kept for future use, so in case they need it to be used in future, they can. So how you prepare the exosome? Very simple. This is the kit. You draw the blood, then you incubate it, you centrifuge it, and then you prepare the exosome. There's a device, you filter it. This is the filter special, this is a patented filter by Biotex, where it looks like a syringe filter, but the pore size is patented and the gel is patented. So that allows only the small particles, as I showed you, to pass through. The other particles will not pass through. Okay. I wanted to, now that the previous slides, if I show you this slide, you will ask me what is the difference between PRP and exosome, right? It looks like a PRP kit, right? It just looks like the same procedure. I show you here. This is PRP. These are the platelets. You see the platelets are forming a platelet plug. They are going together. Okay, I have clicked this photo. Both these photos have been clicked by me. This has been clicked in 2013 or 14, 13, yeah. This is our exosome. Smooth, you can inject it easily. This will block a 34 gauge needle. This will go even through a 34 gauge needle. In case you don't have a microscope, there are other ways. Now, this is an electron microscopy showing the exosomes. As I said, exosome can be detected with electron microscopy. So we have done electron microscopy and we have quantified the number of exosomes. This is an Anton Parr machine. It's called a zeta sizer. It tells us particle sizes. And you see, these are exosomes. Now, the green is where the person has been preconditioned very well. So when you are preconditioned, you have much better chance of exosomes. Yellow is not preconditioned in the right way. So these are some clinical examples. We injected exosome here and you see the scar. So wound healing. Of course, along with exosome, in this we also did some other techniques. Okay. In Malaysia, you can't use ozone, but where I come, you can use ozone. So we used ozone. We also did negative suction. Okay. Then there is something called leech therapy, because normally this would go for amputation. Another 20 sessions. Vitiligo, it's gone. Okay, this is scarring tissue on the face. Not sorry, this is fine lines and wrinkles. This is AK on the face. This is a turkey neck, before after. We use it for when we do fat transfer to the breast, we'll use it. So this is with fat and exosome. This is again fine lines and wrinkles. So sometimes you can mix it with, we call mesobotox. We do a mesobotox along with the exosome therapy. Today there is something called threads, PDO threads. I don't know how many of doing aesthetics. You can do PDO thread, you can do meso, and you can do exo all in one. One sitting, same sitting can be done. Don't need to use that much of filler. Again, under eyes, forehead. So you see, you don't take away every wrinkle in the person, you help the person age gracefully. Full face. So this patient had come to me, actually I don't have the first picture, this is the second picture, but he did not have even eyebrows or eyelashes. He had alopecia totalis. I don't have that picture because I thought it's a case that is never going to get hair back again. So he came with his mother, and he said that he needed the hair, so we just gave him the exosome, we gave him a good preconditioning, and this is what he is as of today. But I did not collect the first picture because I thought that he won't get anything back. So sometimes never underestimate our own treatment. This is in male pattern baldness. This is stretch marks. A lot of people have this issue of stretch marks. Now there is something today what is called cosmetic andrology, like how you have cosmetic gynecology, where you can inject in the corpus cavernosa of the penis. Again, this is before after. This is a case done in cosmetic gynecology. And if you want to do exosome workshop, you can scan and you can join, and it's on the 23rd and 24th. So those of you who want to learn and who want to do hands-on training and a hands-on workshop where you will actually learn 8 hours, 10 hours with the hands-on. And in future, I think Dr. Paramjit is there. You can contact Dr. Paramjit. We will be doing exosome workshop with Dr. Paramjit in MAAFIM. Thank you.
Leroy, just stay on stage for a minute. I'd like to just present you with a token of appreciation. Thank you.
Thank you.